this is my OHI information video. I wanted to just go ahead and start off by basically giving a little bit of a description of the scenario that I came up with for my patient. So let's say this patient has gingivitis, generalized bleeding. There is recession mostly in the premolar to molar areas on both sides, and for the maxillary and for the mandibular. The patient has stated that they floss not regularly, but when they do floss, they use the one on the stick with the floss. They have mentioned that they use a medium bristle brush, and when they do brush, they have more of a just straight like this brushing. So what I would go ahead and first start off with, I would give the patient a mirror, let them show, and I would give them a toothbrush to have them show me how they go ahead and they brush their teeth. So let's say, since I just recently showed, the patient shows me that they are brushing like this all over. So this would not be ideal, especially if the patient has no knowledge that they're brushing really hard or soft. But basically this could cause abfractions to the teeth, especially in the crown of the tooth. So for this specific patient, since the patient does have recession on the premolar to molar areas, I would recommend a base method for the front, and then a modified Stillman brushing for the back. And then the way that I would show that the patient needs to brush, instead of going back and forth, we go in circles. And then once we start getting to the premolar area, we slightly lean this up towards the sulcus, and then if we're doing the mandible, down towards the sulcus, so that way we ensure that some of the bristles, they do go inside to disturb some of that bacteria and make sure that it takes off everything. So that's what they would do for the premolar to the back area, go around in circles, circles. For the floss, I'm sorry, I don't particularly have floss with me right now, but what I would suggest, and what I would also ask the patient, is to show me how they go ahead and they floss. But in this case, since the patient did say that they use the little sticks with the floss on it, they don't particularly have a method, but I would just explain to them that those technically are not that great, just because you're kind of just moving the bacteria back and forth, and sometimes you really don't take out the bacteria. So I would show them that you wrap the floss on one side of your finger, and then you wrap it on the other side. You have a decent amount, so you're maybe like this far apart, and when you're going in to the teeth, I'm sorry I don't have floss to show, but you go inside, you put it, let's say here, and you pull the string to the side, so you do a C-shaped floss method, and you rub it up and down. You go to the other side, rub it up and down, take it out, undo, get some of that, roll one, undo some of the floss, so you could keep on going into the other sides. I know some patients do say that this is a little bit difficult for them to do, but just practice makes perfect. And in regards to the rinse, since this patient does have gingivitis and inflammation and redness, I would go ahead and I would recommend the chlorhexidine gluconate oral rinse. So this is to help reduce the inflammation, redness, and the swelling of the gums. And then to reduce gum bleeding, because while I was doing the cleaning, and I did state to the patient as I was going along that there was a lot of bleeding while cleaning their teeth. gingivitis, and then explain to the patient that gingivitis is caused by the bacteria that grows in the plaque, in amounts of plaque that forms on your teeth and in between teeth also. I would also recommend to the patient, if by any chance they really can't get the hang of flossing, water picks would be great, especially since they have a lot of recession interproximally. They had really deep pockets. I would recommend the water pick, so it makes it a little bit easier, so that way they just go along with the water pick and it disturbs and removes the bacteria buildup. Brushing twice a day. And then the patient also stated that they have sensitivity. In regards to the sensitivity, I would recommend Sensodyne. I have tried it for myself for sensitivity, and it does wonders for me. So I would go ahead and I would recommend Sensodyne for the sensitivity. Yeah, so the OHI would basically be a tell, show, do method, which I would have the patient show me first, and that way I could go ahead and help them better their oral hygiene habits, and that way, just help them take care of their teeth better. Thank you.